Before COVID-19 in Nigeria, there was Lassa fever. According to the Nigeria Center for Disease Control (NCDC), since its outbreak in January 2020, Lassa fever has claimed no fewer than 188 lives out of the 979 confirmed cases in 27 states of the Federation, including the FCT. Now, even at that, there was a decline in case fatality of Lassa fever from 23% in 2019 to 19% in 2020. However, since the onset of COVID-19 in Nigeria, Lassa fever appeared to have been given the backseat, apparently because of the reputation of the pandemic in China, Italy, and South Korea, among others. Now, the NCDC says the emergency phase of 2020 Lassa fever outbreak is over. What strategies were adopted in response to the Lassa fever outbreak? Are there lessons to learn as Nigeria continues to fight against the coronavirus? These will form our focus on Nigeria Today. Welcome to the program. I'm Victor Azu. Now, with us in the studio to discuss Lassa fever, no longer an emergency, is Dr. Isaac Egboja, a public health specialist. Dr. Egboja, nice to have you join us.
Thank you. Good evening.
And also joining us via Skype is Chioma Dan Nwafo, Head National Lassa Fever Technical Working Group. Before now, Chioma was Incident Manager of the National Emergency Operations Center. Chioma, thank you for joining us. All right. While we wait for Chioma, because I'm not too sure that... can Chioma hear me now?
Good evening, Victor. Good evening, Nigerians.
Thank you for joining us.
Thank you for having me.
Now, let's begin with you. What exactly do you mean when you say the emergency phase of Lassa fever outbreak is over?
Yes, like you likely mentioned, since the beginning of the 2020 Lassa fever outbreak, we have recorded a total of 979 confirmed cases across 27 states in Nigeria, including the FCT, with 188 deaths, giving us a case fatality rate of 19%. So at those points, we have reviewed our data, given that in the past 3-4 weeks, we have seen consistent decline in the number of cases of Lassa fever. And we have also brought into consideration other key indicators that we call the composite indicators that inform the Lassa fever emergency threshold. So this includes the number of cases, healthcare workers that are affected, the treatment center capacity, the turnaround time.
I think we've lost Chioma there. I hope it's temporary. But while we wait to reconnect with Chioma there, let me ask Dr. Egboja. Okay. If you can hear us, and you may continue, please. All right, Dr. Egboja, given what you know of Lassa fever, did the current development take you unawares?
Yes, you mean with regards to COVID-19?
No, Lassa fever now.
Yeah.
Exiting, getting out of the emergency phase, like NCDC put it. Did it take you unawares, talking about, the response that was given to Lassa fever?
No, not really. That is what we expect. It is true that last year was worse than this year, but at the beginning of January, around the second week of January, when NCDC activated an emergency phase for the outbreak of Lassa fever, the incidences were going up spirally. However, fortunately, it declined. And about 10 days ago, the the cases were so few that NCDC at this time declares no more a state of emergency. But however, that does not mean that Lassa fever is still not a problem. It is still endemic. Endemic meaning that it is still within us. There are still cases, there are still possibility of cases. What it means is that the acute nature in which it came, the surge in which it came, and the number of cases we had, which were also attended by the fatality rate, is no more the case that we're having now, between January and April.
All right. Now, I don't know if Chioma is back with us. Is Chioma back with us? Okay. Just to take you up from where you stopped earlier, could you give us an insight into the strategies that you adopted to see that we get to this stage in the fight against Lassa fever?
So when we observed the increasing number of Lassa fever cases in January, we activated the Emergency Operations Center. So this ensures a holistic approach in the response and in the coordination of the Lassa fever outbreak. So this involves bringing in other stakeholders and line ministries such as Ministry of Agriculture, Ministry of Environment, because Lassa fever is a zoonotic disease. So it requires the One Health approach. That is a multi-sectoral approach that involves the agric and environment so that we can better contain the outbreak early. So we also have partners that work with us at the EOC. We have the WHO, we have CDC, we have different partners. We have over 30 partners that support the outbreak response. And we've also activated a similar EOC at the state level, because this the Lassa fever response is a state response, but the NCDC supports the state in the response, and we deployed rapid response teams to most of the affected states to support them in the response to the outbreak. We've also supported them with such staff, because at the beginning of the outbreak, most of the treatment centers were overwhelmed. So we had to support our key treatment centers like the ERA Specialist Teaching Hospital and the FMC or War Teaching Hospital with additional healthcare workers in order not to, because of the overwhelming number of cases that they had. We also support them with response materials. We have deployed dialysis machines, ambulances, reagents for diagnosis, and IPC materials. We've continued to train healthcare workers on infection prevention and control. And I mean, there's been a lot that is ongoing for the Lassa fever response, and we keep learning from previous outbreaks. In 2020, you recall, that was when we first had the large outbreak of over 633 confirmed cases. In 2019, we had over 800 cases, and as we speak today, it's just we are just 4 months into the year, and we have over 900 confirmed cases because Lassa fever is endemic. We are saying that the emergency phase is over, but then we will still continue to record cases because Lassa fever is endemic in Nigeria. It's an all year round transmission, but majority of our cases, over 70% of our cases, will be reported between January and now. And this is called high transmission season. Given that during this period, the temperatures are high, so and this rodent tend to move closer to the houses, and this increases the human-rodent interface and the chances of them contaminating foodstuff and humans consuming these foodstuffs and becoming infected and coming down with this disease. And we've also observed increased number of bush-burning activities that will displace this rodent from their natural habitat and move them closer to the human habitat.
Now, just how crucial was the collaboration with critical stakeholders in getting to this stage that we are, Chioma?
Sorry, can you take that question again, please?
Just how important was the collaboration that you had with critical stakeholders that you mentioned earlier in getting to this point in the fight against Lassa fever?
So we cannot overemphasize the need for the collaboration with our partners. Like I earlier mentioned, we have over 30 partners that support the Lassa fever outbreak at the EOC level. In 2016, the DG inaugurated a technical working group, the Lassa fever technical working group. The mandate of this group is to ensure the coordination of Lassa fever response in Nigeria. And we're also going ahead to establish a Lassa fever consortium. This consortium involves treatment centers and key partners that are involved in the Lassa fever response. As you know, we currently do not have a vaccine for Lassa fever. So we are working with partners such as WHO and CEPI, a Coalition for Epidemic Preparedness and Innovation, to ensure that we have an effective and a safe vaccine in the nearest future. So we are working towards carrying out an epidemiological survey study. This study will also be conducted in other West African countries where Lassa fever is endemic to better understand Lassa and to know how to go about the planned clinical trials. In 2019, we had the first Lassa fever international conference. This brought about researchers from all over the world to share the knowledge about Lassa fever and also to chart the way forward and to also find a way to answer some of the unanswered questions. Because the way forward for us is research, and we have a dedicated pillar in the Lassa fever EOC responsible for research activities so that we can better understand this disease and know how to control it better.
Thank you very much, Choma. We'll get back to you in the course of the program. Dr. Boja, what is your own assessment of the response as enunciated by Choma there?
Excellent response. What I'm particularly impressed with is the fact that, one, it has been a multi-sectorial approach. You've heard her. Ministry of Health was involved, Ministry of Environment was involved, Ministry of Agriculture was involved. That is very key. Because like we've said earlier, Lassa fever is a zoonotic disease, meaning that it occurs in both animals and humans. The animals that are involved here are rodents, largely rats. And the Ministry of Environment has a role to play here. The Ministry of Agriculture also has a role to play. You recall, and you do know, being a Nigerian, that at this time of the year, between January and now in particular, December till now, before the rains start, people dry their food outside. Their grains, their cassava, whatever they dry outside. And when they do, rats have the opportunity to go and eat in the night and defecate and urinate on them. And that's one of the reasons why we have the disease. And also, the fact that they have brought in key stakeholders. You mentioned, you heard her, she mentioned a number of organizations. This is not the kind of problem that only one ministry would solve, like Ministry of Health would solve, or NCDC would solve. This is the kind of problem that you need partners, you need expertise, you need people who are treating clinically, and you need people who are also researching as to what would be the solution. For example, right now we don't have a vaccine yet, but it is desirable that we have the vaccine against Lassa fever as soon as possible.
Okay. Now you're watching Nigeria Today. Let's take a short break, and when we return, the program continues.
COVID-19 transmission is mostly through droplets from sneezing and saliva. The most effective way to protect yourself from the virus is to practice good personal hygiene. Wash hands with soap under running water or use an alcohol-based sanitizer if water is not available. Maintain at least 2 meters distance between yourself and anyone who is coughing or sneezing. Cover your mouth and nose with your elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. If you have traveled recently to a country with COVID-19 outbreak in the last 14 days and you have a fever, cough, or breathing difficulty, call NCDC toll-free numbers before going to the hospital. This message is from the National Orientation Agency.
Welcome back. You're on to Nigeria Today in case you've just joined us. And we've been discussing Lassa fever, no longer an emergency, with Chioma Danwafo, who is head National Lassa Fever Technical Working Group. She joined us via Skype, and Dr. Isaac Egboja, a public health specialist, here in the studio. Now, let me go back to Chioma on Skype. Is it safe now, Chioma, to concentrate on COVID-19, given that, well, you say it's no longer an emergency? COVID-19 is an emergency. Is it safe to let go of Lassa fever for a moment and focus all attention on the COVID-19?
Emergency phase of the outbreak has been declared over. That's the critical phase, but then we will keep having cases. So we are not going to drop the ball with the Lassa fever response or any other infectious disease response. We have an ongoing COVID-19 pandemic in the world, but then we also have teams that are dedicated to responding to Lassa fever. Let's also not forget that Lassa fever is also infectious and also very severe. We're talking of a case fatality rate for COVID of about 3%, but for Lassa fever, we have a case fatality rate of 19%. That is quite high. So we cannot drop the ball in the response for Lassa fever. We are keeping our eyes on the Lassa fever response and other diseases too, to ensure that all cases are identified, tested, and if positive, taken to the isolation centers and managed to ensure a decline in the case fatality rates that we have.
Thank you, Dr. Egboja. What lessons, in your opinion, are there to learn from the way that the response to Lassa fever has been taken, given the ongoing COVID-19 pandemic here in Nigeria?
A lot of lessons. Chief among which is the fact that we need to be prepared at all times now, because there are emerging diseases, diseases that we didn't know of before, like the novel COVID-19. We know that coronavirus have been around. We've had SARS and so on in the past, but this particular strain is new. That's why it's called novel. Now, the lesson that we've learned is the fact that, one, we've been prepared. There was a lab from which, in which samples of Lassa fever and other diseases have been tested. And when coronavirus erupted and it became pandemic, they leveraged on the experiences that they have used in the past. The staff that have been trained in handling samples and testing samples and so on and so forth. And the need for us to continue to coordinate and to share information.
All right. So let me quickly get back to Chioma. I hope you can hear me. All right. I was going to ask, you didn't really tell me if there are similarities in the characteristics of both diseases and possible similarities in the response patterns. That is talking about Lassa fever on one hand and COVID-19 on the other.
Yeah, so both Lassa fever and COVID-19, they're both viral diseases that are caused by viruses, but COVID-19 is new, is novel, is emerging. Unlike Lassa fever that has been with us for the past 51 years. Lassa fever was first discovered in Nigeria in 1969. So this is 51 years post-discovery. And Nigeria has the highest burden so far in the whole world of Lassa fever. Over the years, we have scaled up our testing. we are detecting more. We are beginning to, the awareness has improved. The index of suspicion among healthcare workers has also improved. So that is why we are finding more cases. It's not necessarily that the burden of the disease has increased, but it's because the surveillance has improved, index of suspicion has improved, Nigerians are more aware and are reporting, and also testing. In the past, we used to have just 1 lab, 2 labs, but now we have 5 labs that test for Lassa fever on our testing network. And like Prof. Likely said, we leveraged on this molecular lab for the COVID-19 testing. The healthcare workers that we are trained, both for testing and for the surveillance officers, all the structures we are leveraged on for the initial response to COVID-19. The IPC training, the isolation centers, we have over 22 isolation centers in across 17 states. But then going forward post-COVID, or probably when COVID is contained, Lassa fever, the testing for Lassa fever will also be scaled up. We'll also leverage on these new labs that have come up for COVID-19 testing to expand our testing platform, and also the isolation center to ensure that every state has the capacity to manage a Lassa fever case.
Right. Chioma Dan Nwafo, National Lassa Fever Technical Committee Group Lead. Thank you for coming on Nigeria Today.
Thank you for having me, Victor.
All right. Dr. Gboja, if we have to stop community spread of COVID-19, given the experience we have had with Lassa fever, what would it be for you going forward?
Well, the number one thing that it has to be is what we are doing now, the lockdown. Make sure that people stay at home and they don't go about, and to keep testing, keep tracking. When you have a case, you try to look for all contacts of that case and test them, just in case one of them or some of them have been infected. But it is very key, very important for us to stay at home, as it is, as we are doing now. If we hadn't taken that step, by now the number of cases that we would have recorded would have been astronomical.
But by Monday, the doors open and people will have to go out.
Yes. We are going to go out, but still with a lot of caution. A lot of it, not just some, a lot of caution. One, we have to make sure that we still maintain physical, what we've been calling social distance. Actually, it's physical distance from each other. You have to make sure that when you go out, you wear your mask. And you make sure also that when you go out only when it is absolutely necessary. And that you don't just go out for the sake of going out, as we used to do in the past. And also for those who are going out, if you have a chronic disease, like heart problem, chronic heart problem, or you have tuberculosis, or you have HIV, or diabetes, or hypertension, it is necessary for you to limit your moving around, to try and stay at home as much as possible. Why? Because these are the group of people who are prone to succumb very easily to coronavirus when it strikes and when a person is infected. Now, talking about the need for us to be cautious.
Yes.
We are seeing now that the infection has gone to the communities, and we're having now cases that you cannot trace to anybody that came from outside.
Okay.
Okay. And therefore, the need for us to be more cautious, to be more careful, becomes very real.
All right. Thank you very much, Dr. Isaac Gboja, public health specialist. Thank you for your time and perspectives on the program.
You're welcome.
Now you can watch these and other editions of Nigeria Today on www.youtube.com/NTA News 24 Hub. My name is Victor Azu. I thank you for watching.